Have you noticed unusual skin changes after turning 60? Dry patches, discoloration, or strange bruising? On Wellness 60 to 100, your trusted source for healthy aging, we uncover how your skin may be warning you about hidden organ failure. Don't overlook what your body is trying to tell you, starting from the outside in. Marjorie, a 74-year-old retired librarian from Oregon, always took pride in her health. She walked daily, ate well, and saw her doctor regularly. But over the past few months, she noticed something strange. Her skin was turning a yellowish tint, especially around her eyes. Small bruises began appearing on her arms, even though she hadn't bumped into anything. Her daughter urged her to get it checked, but Marjorie hesitated. "It's probably just aging," she said. Finally, during a routine checkup, her physician ordered liver function tests. The results were alarming. Marjorie was in the early stages of liver failure. The changes in her skin weren't cosmetic. They were her body's cry for help. Her doctor explained that when the liver struggles, toxins build up in the blood, often revealing themselves through the skin first. The bruises were a sign her blood wasn't clotting properly. The yellowing? Early jaundice. Marjorie's story isn't unique. Many seniors ignore subtle skin changes, thinking they're just normal parts of aging. But sometimes, your skin knows something you don't, and it's trying to save your life. I'm Dr. Emily Carter, a board-certified geriatrician. Skin changes after 60, like unexplained bruising, yellowing, or dryness, can be early signs of serious internal problems. As we age, the skin often reflects what's happening inside the body. In this video, I'll explain how to recognize these warning signs before they turn into life-threatening conditions. Your skin is more than just a protective layer, it's a mirror of your internal health. After age 60, subtle changes in skin color, texture, or sensitivity can be early clues to serious organ dysfunction. On Wellness 60 to 100, where we focus on healthy aging, today's episode reveals how conditions like liver failure, kidney disease, or heart problems often show their first signs on the skin. Ignoring these signals can delay diagnosis and put your health at risk. We'll walk you through the warning signs to watch for, explain what they mean, and show you how early action could prevent life-threatening outcomes. Your skin may be speaking. Are you listening? Your skin is often the first place your body shows signs that something's wrong inside. As the largest organ in the body, the skin is deeply connected to your internal systems, especially the liver, kidneys, heart, and lungs. When one of those organs begins to fail or struggle, it can affect the skin in surprising and visible ways. For example, the liver plays a major role in filtering toxins from the blood. When it becomes overburdened or damaged, substances like bilirubin can accumulate and cause yellowing of the skin, a condition called jaundice. This yellow tone is often most visible around the eyes and face, and should never be dismissed as a normal sign of aging. The kidneys, responsible for removing waste and regulating minerals, also impact skin health. If kidney function declines, waste can build up in the blood, leading to itchy, dry, or grayish skin. Some people may even develop a waxy texture or unusual rashes. The heart and lungs affect how well oxygen is delivered to the skin. Bluish or purplish tinting, especially in the fingers, lips, or toes, may signal poor oxygenation, sometimes due to heart failure or chronic obstructive pulmonary disease, COPD. Another critical indicator is bruising. Easy or frequent bruising, especially in places not prone to impact, may point to blood clotting issues linked to liver dysfunction or low platelet counts caused by bone marrow or spleen problems. These changes are not just cosmetic or age-related, they're biological red flags. Paying attention to skin symptoms can lead to earlier diagnoses of diseases that might otherwise remain hidden until much later stages. By learning how to interpret the skin's warning signs, older adults can protect themselves and take control of their health before a crisis occurs. Your liver works 24/7 to filter toxins, regulate blood chemicals, and support digestion. But as we age, the liver becomes more vulnerable to damage, whether from medications, alcohol, fatty liver disease, or chronic infections like hepatitis C. Alarmingly, Early liver damage often reveals itself through the skin long before internal symptoms appear. One of the most recognizable signs is jaundice, a yellowing of the skin and whites of the eyes. This occurs when the liver fails to properly process bilirubin, a waste product from the breakdown of red blood cells. Jaundice is not just a cosmetic issue, it signals serious liver dysfunction that requires immediate evaluation. Another telltale sign is easy bruising, particularly on the arms, legs, or even abdomen. A damaged liver produces fewer clotting factors, making the skin more prone to bruises without obvious injury. If you're noticing purple spots or unexplained bruises, it's time to speak to a doctor. Spider angiomas, small, spider-like blood vessels just under the skin, often appear on the face, chest, or hands. They're caused by hormonal imbalances resulting from liver dysfunction and are commonly seen in cirrhosis patients. You might also notice itchiness without a visible rash. Bile salts that accumulate in the bloodstream when the liver is impaired can irritate nerve endings in the skin, causing persistent itching that's often worse at night. In more advanced cases, the skin may appear leathery or waxy, and the palms may become red and inflamed, a condition known as palmar erythema. What's dangerous is that these skin symptoms are often misattributed to dry weather, allergies, or normal aging. But for those over 60, they could be the body's first and only early warning of liver trouble. Regular liver function tests, especially for seniors with a history of alcohol use, obesity, or chronic medication use, can catch issues before they escalate into liver failure. Your kidneys play a vital role in removing waste and balancing fluids in the body. But when kidney function declines, especially in older adults, the symptoms often go unnoticed. One of the most overlooked yet visible warning signs appears on your skin. Chronic kidney disease (CKD) affects nearly 1 in 7 adults in the United States, many of whom are over 60. As the kidneys lose their ability to filter toxins, those waste products build up in the bloodstream, leading to dry, flaky, or rough skin. Seniors may dismiss this as seasonal dryness, but in many cases, it's a sign of uremic pruritus, a form of skin irritation caused by kidney dysfunction. Another clue is generalized itching, especially on the back, arms, or scalp, without a rash. This itchiness is often worse at night and doesn't respond to moisturizers or allergy treatments. It's not a skin problem, it's a systemic one, indicating waste retention in the blood. In more advanced kidney failure, the skin may take on a pale, grayish, or even yellow tone due to anemia and toxin buildup. Some individuals develop uremic frost, a rare but serious condition where white, crystal-like substances appear on the skin's surface, literally waste being excreted through the pores. You may also notice swelling, edema, particularly in the lower legs and around the eyes, which stretches and distorts the skin. This happens when the kidneys can't regulate fluid balance properly. Unfortunately, many people mistake these symptoms for aging or dermatological issues, delaying proper diagnosis. But when kidney-related skin changes appear, it often means the kidneys have been in trouble for some time. If you notice persistent dryness, unexplained itching, or unusual skin tone changes, especially along with fatigue or swelling, it's critical to request blood and urine tests that check for glomerular filtration rate, GFR, and creatinine levels. Your skin may be quietly signaling that your kidneys need help. Listen before it's too late. When we think about heart or lung disease, we often picture chest pain, shortness of breath, or fatigue. But one of the most telling, and often ignored, signals appears on the skin. For older adults, changes in skin color, temperature, and texture may be early warning signs of cardiovascular or pulmonary problems. One of the most common signs is cyanosis, a bluish or purplish discoloration of the lips, fingertips, or toes. This occurs when the blood isn't carrying enough oxygen, often due to conditions like chronic obstructive pulmonary disease, COPD, congestive heart failure, CHF, or pulmonary embolism. Seniors may notice this tint during cold weather or while resting, assuming it's circulation-related, but it can signal poor oxygen delivery from the lungs or heart. Another clue is cold, clammy skin, particularly during or after minimal physical activity. This may indicate a weakened heart that's struggling to pump blood effectively. In some cases, it's a red flag for impending heart failure. Clubbing of the fingers, a condition where the tips of the fingers enlarge and the nails curve downward, is often linked to long-term lung disease or congenital heart defects. While painless, it signals chronic oxygen deprivation and requires immediate medical evaluation. People with peripheral artery disease (PAD), a circulatory problem common in older adults, may experience shiny, hairless skin on the legs or feet, slow wound healing, or even open sores. These signs indicate poor blood flow and increased risk of heart attack or stroke. In some cases, rash-like eruptions or purplish dots, called petechiae, may indicate inflammation of the heart lining or valves, known as endocarditis. Your skin is often the canvas on which heart and lung disease quietly paints its first strokes. Don't wait until breathlessness or chest pain sets in. If your skin is changing, your heart or lungs may already be under stress. Skin changes can seem minor, dry patches, odd bruises, or subtle discoloration, but in older adults, these may be the body's first warnings of serious internal dysfunction. The key to protecting your health is knowing when to seek help and what tests can uncover the root cause before it becomes life-threatening. You should consult a doctor if you notice any of the following: yellowing of the skin or eyes, unexplained bruising or bleeding under the skin, persistent itching with no visible rash, pale, gray, or bluish skin tones, skin that becomes thin, shiny, or swollen, fingertip clubbing or purple spots, petechiae. These symptoms may indicate liver failure, kidney dysfunction, circulatory disease, or oxygen deprivation due to heart or lung conditions. When you visit your healthcare provider, a thorough evaluation may include liver function tests, ALT, AST, bilirubin, to assess liver health, kidney function tests, creatinine, GFR, BUN, to detect impaired filtration, complete blood count, CBC, to identify anemia or clotting issues, electrolyte panels and metabolic tests to evaluate organ balance, pulse oximetry and arterial blood gases, ABG, to measure oxygen levels, chest X-ray or echocardiogram if cardiovascular issues are suspected, urinalysis and imaging, e.g., ultrasound or CT scan, depending on findings. Many older adults delay these evaluations out of fear or because the symptoms seem mild. But waiting can lead to rapid disease progression and missed opportunities for early intervention. The truth is simple: your skin is trying to speak up when deeper organs are in distress. Listening to these clues and acting quickly can give you a chance to treat problems early, avoid complications, and maintain your independence and vitality longer. Ignoring skin changes after 60 can lead to devastating consequences. What seems like dryness, discoloration, or minor bruising may actually signal liver failure, kidney disease, or heart problems in early, but reversible, stages. When these warnings are overlooked, conditions progress silently, often until a crisis occurs, organ collapse, hospitalization, or even loss of life. Seniors who delay care risk missing the narrow window where treatment is most effective. Worse, the damage may become permanent by the time obvious symptoms appear. Recognizing what your skin is telling you can mean the difference between early intervention and a medical emergency. Don't give disease a head start. Act while you still can. As a geriatric specialist, I urge every older adult to pay close attention to their skin. It often reveals what blood tests and scans haven't yet caught. If you notice unusual bruising, yellowing, persistent itching, or any change in skin color or texture, don't assume it's just aging. These could be signs of liver stress, kidney decline, or poor circulation. Schedule an appointment with your doctor and request a full metabolic and organ function workup. Don't wait for pain or extreme symptoms to take action. Prevention starts when subtle signs first appear. In the meantime, keep your skin hydrated, avoid excessive sun exposure, and maintain a heart-healthy, low-sodium diet. Most importantly, keep an open line of communication with your healthcare provider. A single conversation today could prevent a medical emergency tomorrow. Your skin is speaking. My advice? Start listening. Your life may depend on it. If this video opened your eyes to what your skin might be telling you, don't keep it to yourself. Like, share, and comment below to help others stay informed. And make sure to subscribe to Wellness 60 to 100 for trusted, expert-backed guidance on healthy aging. Tap the bell so you never miss a life-saving tip.